Good morning, everyone, and thank you for the introduction. I should start with a very brief confession that I am a relative newcomer to the field, Parkinson's disease. I stumbled into it somewhat by accident, as I'll explain, and that's a good reason to come to meetings like this, to move a little higher on the learning curve. I'll explain how we got into this in a minute. Unfortunately, you can't see all the co-authors very well, but I'll mention them again at the end of the talk so you know who the participants were. I have spent a good many years as my professional life studying gangliosides in the nervous system, and particular interest in this GM1 ganglioside. And what we have found, in short, is that we believe we, by accident, have found what we think might be an important clue into the etiology of sporadic Parkinson's disease. Unlike the familial forms, there is no cogent explanation for the etiology of the vast majority. About 90% of Parkinson cases are idiopathic. And we think it may have, that this GM1 ganglioside may provide an important clue in that respect. And we also have some data showing how the defect that we know occurs both in a mouse model we have as well as Parkinson patients can be cured by restoring GM1 GDNF signaling. So, just by way of disclosure, I do have an association with the Seneb Biosciences Incorporated and current collaborators with a pharmaceutical company. And this is just to review the well-known fact that the major emphasis in this disorder has been on the movement aspect. Also the fact that it is a disease whose primary risk factor so far has been aging. Well, okay. A little bit of the history, which I won't have time to go into. This is, I think, is well known by most of our participants. This simply shows the review of the basal ganglia, which is largely responsible for the movement aspect of Parkinson's disease. And these are the Lewy bodies, which are the hallmark neuropathological change, and that was the basis for Brack's six-stage process hypothesis. And the movement part doesn't appear until stage 3 and 4. It's preceded by the prodromal stage involving the enteric nervous system as well as lower brainstem, and it's followed by an involvement of the larger aspects of the brain, the cortex, where you have cognitive disorder. We were studying a mouse that was lacking the GM1 family of gangliosides, and I'll show you what that family is in a moment. We were interested in that time in the function of gangliosides in the nucleus, and it turned out that they have an important role in calcium regulation. But what we noticed was that the knockout mouse, in particular, and to some extent the heterozygote, had a movement problem. As you can see in this case. Now the GM1 synthesis is carried out by this pathway, starting with the GM3 ganglioside, which employs a galactosamynyl transferase to put on a galactosamine at this position, and then a galactose, and that can be followed by another sialic acid to give GD1A. So the knockout is this step, the galactosamynyl transferase, which is the B4-gal-NT1 gene that produces this enzyme, and a litter of pups generated by mating of heterozygotes gives a pattern like this, and it's very easy to distinguish the knockouts, the 4 knockouts here, which are missing the major ganglioside. This is a thin layer chromatogram with a compensating increase in those that are not knocked out, such as GD3 and GM3. There is a small qualitative change in the heterozygote compared to the wild type, but a very large quantitative change, as I'll show you, because the heteros contain about half as much of the GM1 family as the wild type. So this shows the synthesis of GM1 and GD1A. Whoops, I didn't mean to advance that just yet. This is not cooperating very well. Okay. Yes, that's GM1. Now we're at GD1A. Now, GD1A can lose that extra sialic acid by neuraminidase or sialidase, which is an enzyme that occurs in the membrane in proximity to GD1A. So it is a metabolic precursor of GM1. It has functions of its own, but one of its primary functions is a pool, a reserve pool, for the formation of GM1 when a sizable amount is needed. So this is the mouse. This is not cooperating with me. It should show the movement problem that it has. I hope you'll take my word for it, that it does not move very well, particularly as it ages. And we ask then the question, could this show other symptoms of Parkinsonism besides the movement problem? And these were the criteria of Parkinsonism that we pursued. So first, to more fully document the movement problem, we use the grip duration. A normal mouse will attach its paws to a horizontal rod like this and hang on for a considerable period, 2 minutes or more, whereas the knockout was not able to hang on at all. It dropped right away. This is a standard test for a movement problem, but it's only one of the 3 tests that we used. In any case, this shows the difference between the wild type, able to hang on for a considerable period, the knockout, and somewhat to our surprise, the heterozygote was also disabled to virtually the same extent as the knockout. And the reason that was at different ages that we employed, the reason this got our attention is that we subsequently found that Parkinson patients have a similar GM1 deficiency naturally as the mouse does. And that's why we developed the idea that this mouse is a very good model for Parkinson's disease. Now, if it is a true model, it should recover, so some recovery with L-DOPA, which this mouse model did. You can see that the heterozygote, which could hang, the grip duration was very short, but it improved considerably with L-DOPA. The knockout also improved. We often, even though the hetero is what we consider the model, we often use the knockout for comparison. It gives a little more emphasis to the effect of GM1 deficiency. And we study at different ages. This is irritant removal, in which a substance is placed on the snout of the mouse. It's an irritant, and a normal mouse will pull it away quite quickly, whereas with this defect, it takes longer for the mouse to discover that there is a way that it can remove the irritant, and that's why its time is extended for both the hetero and the knockout, and to some extent this is corrected by L-DOPA, both at 200 days of age and 350 days of age. Now, in addition to recovery with L-DOPA, we found that we could induce recovery with a substance called Liga-20. Liga-20 is really GM1 with a slight structural change. You can see here's the structure of GM1 with its 5 carbohydrates, one of which is this acidic group, sialic acid. This is not removed by neuraminidase the way the GD1A sialic acid is removed. This is resistant. And the only structural change is in the ceramide hydrophobic unit, in which the stearic acid is replaced by dichloroacetyl in its amide linkage to sphingosine. And that's enough of a change to make this analog membrane permeable. And because of that membrane permeability, it is able to cross the blood-brain barrier with greater facility and, very important, enter the cell. And as I'll show you, there are functions of GM1 that are very important to the cell survival that occur intracellularly. So here is recovery of the grip duration test with LIGA-20. You can see the heterozygote shows considerable recovery over a 5-week period. The knockout also shows some recovery at a longer age, 35, 350 days of age. The heterozygote again starts out with no ability, but then it soon exceeds the wild type in its ability to hang on to the horizontal rod. And this shows what happens when the treatment is stopped. By the way, the treatment consists of injecting the material intraperitoneally. I say it's able to cross the blood-brain barrier. And there's a gradual fall-off in activity in the recovery over a period of weeks. Another test we used was the pole test, how long it takes a mouse to climb the pole, turn around, and come back down. The wild type is able to do it quite rapidly. The hetero and the knockout take longer, and those were also improved by LIGA-20. And the final movement test, as I mentioned, was this irritant removal, in which that too was improved by LIGA-20 in the hetero and the knockout. Now, another test for Parkinson criteria is loss of tyrosine hydroxylase positive neurons. As I'm sure you know, tyrosine hydroxylase is an enzyme essential for the synthesis of dopamine. And in the substantia nigra, this shows a significant decrease in Parkinsonism. And here you can see the histochemistry of TH staining and the wild type compared to the hetero treated with basic salt solution. There's a considerable loss of staining, but it's recovered to a large extent with LIGA-20, showing that the neurons did not actually die. They simply became dysfunctional and dormant and were brought back into a functional state by this GM1 analog. Same thing for the knockouts. I'll get to the synuclein in a moment. I just want to show you that the same result was obtained with stereological analysis, showing at different ages of the animals with significant recovery with LIGA-20. Now, depletion of dopamine in the striatum was also clearly evident in this model. You can see that the dopamine level in the wild type, which tends to decrease with aging in the mouse, there's considerably less of that in the hetero and even less in the knockout at different ages. And there is at least a significant level of recovery with this LIGA-20. And finally, aggregation of alpha-synuclein. Rodents do not normally show full Lewy bodies, but they can show aggregated synuclein. This is one indication. You can see the increase, staining at least, in the heteros that were treated with basic salt solution. And this was resolved to a considerable extent with the LIGA-20. The same in the knockout. And another illustration of that is in the Western blot, showing aggregated forms in the saline-treated knockout or the saline-treated hetero, and again, much less of that after treatment with Liga 20. You can see it even clearer in the older animals. There's a lot of aggregation of higher molecular weight alpha-synuclein, and that too is alleviated partially, at least, by Liga 20. Now, GM1 and its metabolic precursor, GD1A, decrease with aging in both mouse and man. First, the mouse, we found that in the wild type, there is a substantial decrease as the mouse ages in both, and also in the hetero. Same thing for GD1A. Those are the two members of what we call the A series. Less of that, although there is some decrease with the B series. They have different functions. This can be seen on thin layer. If you look at these 4 examples of wild type, there is a progressive loss that can be quantified, both GM1 and GD1A. And the same thing is true in hetero mice, which start at a lower level. And we also wanted to satisfy ourselves that this was a systemic effect, this reduction of GM1 in the liver, other parts of the brain, and every tissue we looked at. There is this reduction of GM1. Now, what about the human case? This was a study by Lars Svennerholm in Sweden many years ago, in which he quantified GM1 in brain over from young adults to old age, and there is progressive decrease. But the key thing here was that most of that decrease is due to this A series, that is GM1 and GD1A. That is shown here on this graph for the total. This is the A series. Actually, the B series goes up for a short time and then drops down with aging. This loss of the A series corresponds to some extent, I think, to the slide we saw yesterday in which dopamine decreases with aging. So the question then is, are A-series gangliosides deficient in Parkinson brain at the actual patients? We were able to get some tissue sections from the Columbia Brain Bank, which we stained with GM1 and 4-alpha-synuclein in order to detect the TH, the dopaminergic neurons. In the controls, we used the TH, anti-TH antibody, which isn't shown here. But you can see that there is considerable ganglioside in the green. We found ganglioside both in the plasma membrane, shown with arrows, in the nuclear membrane, showed with arrowheads, and considerably less of that. Here we had to use synuclein to identify the dopaminergic neurons. And in fact, the total green staining is considerably less, meaning since the dopaminergic neurons are not the major cell type in the substantia nigra, there is a systemic deficiency of GM1. This at least was suggested in this study. And it can be quantified in this manner, showing a highly significant loss. One could say that, well, these are this is pathological part of the brain, so the decrease in GM1 may be the result of the disorder rather than the cause. That's a legitimate question. So we looked at another part of the brain which is much less pathological in Parkinson, namely the occipital cortex. And there we found the same thing, that there is a significant deficiency of GM1. This shows just 2 cases of Parkinson compared to 2 cases of age-match controls. Age matching is important. We also show here how we quantify. These are standards, increasing amounts of standards, which give us a standard curve. And using densitometry, you can get a good measure of the amount of the A series. And you can see GD1A, the other member, is also decreased, and we quantified in that manner 13 different cases, And there is a very significant drop in the amount of the GM1 and GD1A components. Virtually every one of the Parkinson cases was below the average for the control. And the same was true for GD1A, although there is a bit of overlap, naturally. Now, why is GM1 important? Why would it matter if there is a reduction, a significant reduction, not all the way to zero, but just a reduction in the amount of GM1? This gives part of the picture. It turns out that GM1 has many functions in the brain. This shows four main categories, some in the plasma membrane, where you have neurotrophic activity that requires GM1, but also inside the cell, which is why membrane permeability is so important. One case we were interested in the regulation of calcium in the nucleus, which requires GM1. There's a sodium-calcium exchanger in the nuclear membrane tightly associated with GM1, which cannot function without that association. And that maintains calcium homeostasis in that part of the cell. Another one that's quite relevant to Parkinson's disease is its ability to disaggregate fibrillar forms of alpha-synuclein. There have been some key publications on that from Fink's lab, showing that G1 specifically interacts with alpha-synuclein to inhibit fibrillation. The other gangliosides and acidic lipids were not effective, but a more recent study from Dennis Selko's lab showed that in alpha acetylation of alpha-synuclein, it increases its folding propensity, its affinity for GM1, and also its specificity, resistance of synuclein to aggregation. Coming back to the plasma membrane now, there's a lot of work that has been done on nerve growth factor, BDNF, and other trophic factors. We now know that these are essential for maintaining the viability of neurons. Unlike other cells in the heart, the kidney, the liver that turn over, brain cells with their thousands of synaptic connections do not turn over, and they're very dependent on neurotrophic factors for their lifelong survival. There has been some excellent studies by Muto and co-workers in Japan showing that GM1 binds to TRAC-A protein and also TRAC-B, and that in fact those neurotrophins cannot function without the GM1 association, similar to the sodium-calcium exchanger that I mentioned. This is the paper showing the same thing for TRAC-B. We were interested in the GDNF trophic support because this has been called an essential trophic factor for the survival of catechol-aminergic neurons in the adult. They do have a role in differentiation also, but this paper claimed an absolute requirement for GDNF. That has been questioned to some extent now, whether it's absolute. There's a lot of redundancy in the brain among these trophic factors, but I think there's little doubt that this is a key one in maintaining catechol-aminergic neurons. What we found is that its receptor also depends very much on the presence of GM1, shown here. There are two protein components to this receptor. One is RET, which is the tyrosine kinase component. The other is GFR alpha, which is the binding site for the ligand, in this case GDNF. That cohesion occurs, the combination of GFR alpha with RET can only occur if GM1 is present. And then there's dimerization to give you a functional trophic receptor. And a series of signaling cascades that are required for viability. Now, what we found was that the GDNF signaling is impaired in the absence of GM1 or the deficiency of GM1. One indication of that signaling pathway is functioning is the formation of phospho-RET. And here you can see the histochemical evidence for that. Both the knockout and the hetero show considerably less phospho-Rhet compared to the wild type. This is TH staining. And to a large extent, that is alleviated, that deficiency is alleviated by Liga 20, once again. Those neurons did not die, they were simply dormant. This was shown by this means immunoprecipitation from the substantia nigra of these mice with anti-GFR alpha 1, and then immunoblotting for either Rhet or pre-Rhet showed progressive loss of cohesion with diminished GM1 in the hetero and the knockout. The other thing that study showed is that if you take the immunoprecipitate, extract the lipids, and run thin layer chromatography, you find that GM1 is there in association whether you immunoprecipitate with GFR alpha 1 or the other component of the receptor, Rhet, which becomes phospho-Rhet. So this was our conclusion from that. The GM1 is actually part of the GNF receptor complex. It's a tripartite complex composed of the two proteins plus GM1. It causes the combination and the formation of a cohesive receptor, and it is impaired by subnormal levels of GM1. Does the same thing apply to Parkinson patients? The answer was yes. Again, employing the slides that we obtained from Columbia, we showed that the controls, age-matched controls, showed considerable staining in those neurons of the substantia nigra for phospho-Rhet, considerably less for the Parkinson cases. And there again, we had many that we quantified. I don't have a slide to show that, but it did turn out to be that way. So here we have our analysis, and that of Lars Federholm, showing that the A series, GM1, GD1A, vary significantly among individuals and decline markedly with age. And we hypothesized that age-related decrease of GM1 and GD1A reaches a threshold level below which there isn't enough to support GDNF signaling, and we believe the same is true for the other trophic factors, although we don't yet have firm evidence for that. So it's not necessary to use a toxic substance to induce Parkinsonism. Aging alone is enough to induce it through reduction of the A-series ganglioside. And on that basis, we propose a gradual loss over a long period of time. Gradual loss of catecholaminergic neurons gives rise to sporadic Parkinson's disease, and it may not be limited to catecholaminergic neurons. Coming back to Federholm's data, he showed that in addition to this age-related decrease, there was considerable variation among individuals of approximately the same age in the amount that they start life with and the amount that they have as they progress toward aging. So we imagine that those in the low normal range are the ones that reach the point. They start life with their neurons fully functional, but as they age, they reach that threshold level below which there is gradual loss of trophic support for the dependent neurons. Now, GM1 has been used in clinical trials for Parkinson's disease. This is mainly the work of Jay Schneider in Philadelphia, who actually carried out a 5-year study before this one that showed some efficacy for GM1, but it was criticized because he didn't have controls. So this one was a controlled study and also used the delayed start format, which I guess is considered now the gold standard for such trials. And what he found, his group found, was that he used first a loading dose, a very large pellet load of GM1, And then this was followed by 100 milligrams of GM1 twice a day, administered subcutaneously. The first one was IV. And there was an early symptomatic effect, which I'll show you, and then slowing of symptom progression over a 2-year period. So this was his data. This was the early effect, in which there's a symptomatic improvement. This is UPDRS score. Lower scores mean more movement, higher scores more impaired movement. And here, this initial improvement was followed by a much slower rise in the score compared to the comparison group. This was Parkinson patients with standard treatment. And this was a delayed start that started 24 weeks after the initial, and it also showed the symptomatic improvement in the beginning, followed by parallel rise. This was a very large amount of GM1 that was required, twice a day subcutaneous administration. That is because only a small part of the injected GM1 is actually able to get across the blood-brain barrier, which brings us back to the utility, we feel, the great utility of these analogs, which don't require nearly as much, at least in the animal. They have not yet been tried in the human. Now, finally, non-dopamine lesions in Parkinson's. We now know that the dopaminergic story, movement disorder, is only part of the story. There have been quite a lot written about non-dopamine, non-movement disorders in Parkinson's. This book dealt with quite a number of these. And so we asked the question, does our hetero mouse, which we are proposing as a model for Parkinson, show any of these non-movement disorders, non-dopamine disorders? And we studied 3 so far. One is gastrointestinal. Are these mice constipated? Cardiac sympathetic denervation, and cognitive dysfunction. The answer to all 3 of these was yes. I'll just quickly show you the data. We had 3, well, first to show that the colon of the mouse does have this gene, the same A series, GM1, GD1A deficiency as the wild type that we showed previously for brain. Then one measure of constipation is the fecal load in the colon. It's quite simple to measure that portion of the colon which is occupied by fecal matter. And in the case of the knockout mouse, this is a considerable amount. Compared to the wild type, it's twice as much at least. And the hetero is in between. Another way of quantifying constipation, at least correlating the histochemistry with that, is to show alpha-synuclein aggregation in the enteric neurons. Here we showed alpha-synuclein increasing. If we dim the lights, you could probably see that better. Increasing in the hetero, even more in the knockout, and alleviation to a large extent with Liga-20 administered to the mouse. Looking at different neuronal types in the enteric neurons, we showed at least 3 types showed this quality of increased alpha-synuclein. One was tyrosine hydroxylase positive neurons. Then there's vesicular acetylcholine transferase. These are cholinergic neurons showing synuclein increase in both the hetero and the knockout. And the same thing for vasoactive intestinal peptide. Those were quantified by fluorescence intensity. This too could be corrected to a large extent with Liga-20. in the case of the hetero. And the third test that we used was fecal water content. It's, I think, fairly well established that constipated fecal matter dehydrates during its longer period of passage through the intestine. And we found that to be the case. Comparing the wild type with both the knockout and the hetero, there was a significant difference, a significant loss of water in the two that lacked or were deficient in GM1. Now, cardiac sympathetic denervation, we looked at the superior cervical ganglion, which contain the cell bodies that send axons into the cardiac tissue. And they showed in this mouse also an increase in alpha-synuclein, both hetero and knockout, with some reduction by Liga 20. The final thing was cognitive dysfunction. This is a later stage in Parkinson's disease. It involves cortical and other neurons. And we found in the case of the knockout, showed at the top, that there was a significant loss of that quality. What this test is the T-maze test, in which a mouse is allowed to run down the first runway of the T, and then it comes to the choice that it makes in going either left or right. If you force it to go in one direction the first time and then retry the mouse where it has a choice of both sides, it will invariably choose the opposite side. It wants to explore something that it has not already explored. Maybe looking for food, maybe looking for a mate, whatever. Now, a normal mouse will pass that test very well. It remembers which side it chose, whereas the knockout mouse showed some impairment even at 50 days of age. 200 days it was grossly impaired. Its choice was about 50-50, which is statistical chance. And this was restored by Liga 20. Same thing with the hetero, except it was a little different now. With the hetero mice did not show the defect at 50 days. At 260 days of age, they were beginning to show the deficiency, which was not restored by Liga 20, given at a dose of 2.5 milligrams per day, 3 times a week. At a later age, there was again no restoration by Liga 20, but if we increase the dosage from 2.5 to 10 milligrams per day, then there was restoration of that memory function. So, to summarize, our partial GM1 deficiency in this B4-gal-NT1 hetero mouse produces Parkinsonism, including at least these 3 non-motor symptoms. All symptoms were alleviated with Liga 20, a membrane-permeable analog of GM1. Parkinson patients show marked GM1 deficiency in neurons of the substantia nigra, pars compacta, the occipital cortex, and colon. We believe, and we intend to do more work to find out if this is truly a systemic deficiency in Parkinson patients. The patients showed marked deficiency of GDNF signaling in those nigral neurons, the same as the HT mouse, and therefore we believe that this mouse shows true recapitulation of Parkinson symptoms. It presents a very accurate model of Parkinson's disease. The results with this mouse point to GM1 replacement therapy with GM1 analogs as a potentially useful method of treating Parkinson's disease. So I'd just like to introduce you to some of the beautiful young people who did a lot of this work. A rather non-young person in the middle who was happy to have them in his lab. A lot of credit goes to Dr. Gusheng Wu, who did the mouse work and a lot of the histochemistry. His wife, Jiwa Lu, who was an expert at creating these thin layer plates that gave us quantification data. And there were a large number of students who participated, and we have current collaborators at UCSF, John Forsyth, Piotr Hadacek, and we, as I mentioned, we also have a collaboration going with the Seneb Biosciences, in particular, Sean DeFries. Thank you very much.